When a patient comes and says, my joints hurt, what exactly is happening in their bodies?
So it's a very important when a person comes in to establish exactly what the cause of the joint pain is. First and foremost, is the joint really involved? Because sometimes we can have what's called referred pain, where a patient has a disease or a problem elsewhere in the body and they actually experience it in the joint. So we call that referred pain. So is it the joint per se, so which we call intercapsular or intra-articular issues, or is the pain actually coming from structures around the joint? So when a patient comes in with joint pains, it's critical to establish exactly what the source of the pain is, and we start from there.
But then at what point do patients feel, is it necessary for a patient to actually do something about it? Like they're at home, they're feeling all this pain. At what point do they need to do something about it?
So I always tell patients that if the pain is enough to worry you, then you need to go and seek medical advice.
So let's say maybe you have 6 patients coming into your clinic and they say, I have joint pains. How different will their stories be?
So arthritis does present with joint pains, but we do have what's called arthralgias, where you just have pain without any evidence of inflammation. In terms of what causes this, there are over 100 causes of arthritis. So that's why it's not enough to diagnose someone and tell someone, or when someone tells me they've got arthritis, you need to dig deeper and say what exactly is the cause, because treatment varies depending on cause and also the prognosis, meaning the outcome for the patient, what else to look out for, because sometimes when patients present with joint pains, it doesn't necessarily mean that it's just your joints that are involved. You can have other symptoms that can help to point towards more menacing diseases.
Welcome to MedTalk, brought to you by Cospharm, where we believe your health is your wealth. On today's episode, we are discussing a topic that most live with quietly, but is quite common: joint pains. Some knees that are resistant to stairs, a stiff finger, or a back that doesn't quite match your age. But most of us, we sit at home, we don't know what to do, we self-medicate. If some of these things that I'm mentioning are things that you're familiar with, this conversation is for you. We are joined today by one of our doctors, a specialist physician and rheumatologist. Her name is Dr. Rukarwa from Rheumatologist Clinic based in GPH. Dr. Rukarwa, welcome to MedTalk.
Thank you so much for having me.
Yes. Can you please tell us more about yourself? Share with the audience also your experience as a rheumatologist and physician.
So my name is Dr. Rukarwa. As you mentioned, I'm a specialist physician and rheumatologist. And after my postgraduate training in internal medicine, I was a bit confused into which specialty to get into. But I think what influenced my choice in rheumatology is the fact that, one, it's a very underserviced specialty. For example, in Botswana, currently there are only 3 practicing rheumatologists, and worldwide, the ratio of rheumatological or population and rheumatologists is very small. So it's a specialty that is in demand, and once people are aware of it, then they will be aware of the need of managing these chronic diseases. So for me, it's a passion I have because it's challenging as well as fulfilling as well. Yeah.
That's a beautiful story, and for such a rare specialty. So Dr. Rukarwa, let's get right into it. When a patient comes and says, my joints hurt, what exactly is happening in their bodies?
So it's a very important when a person comes in to establish exactly what the cause of the joint pain is. So for me, when I look at a patient who comes in with a complaint of joints, you need to be able to understand, first and foremost, is the joint really involved? Because sometimes we can have what's called referred pain, where a patient has a disease or a problem elsewhere in the body and they actually experience it in the joint. So we call that referred point. Then if it indeed is the joint, you also need to be able to establish which part of the joint is involved. So is it the joint per se, so which we call intercapsular or intra-articular issues, or is the pain actually coming from structures around the joint? So not just the joint itself, so you're looking at things like your tendons, where your muscle attaches to the bone. You're looking at ligaments that hold your joints together. Those can be involved. You're looking at structures such as bursa, which are small cushions that are in your joints that act like shock absorbers, as well as also your muscles as well as skin. So when a patient comes in with joint pains, it's critical to establish exactly what the source of the pain is, and we start from there.
Okay. But then at what point do patients feel, is it necessary for a patient to actually do something about it? Like they're at home, they're feeling all this pain. At what point do they need to do something about it?
So I always tell patients that if the pain is enough to worry you, then you need to go and seek medical advice. Because honestly, on a day-to-day, most of us do suffer from some pain of some sort. But once it's enough for you to feel like this is not okay or this is out of the ordinary. So I usually give patients an example to say, if your pain is persistent for a week or more, or sometimes depending on severity, if it's disabling, you're not able to move, you're not able to function, it's affecting quality of life, then definitely you need to come in and get it assessed. So it's important for a patient to be able to assess for themselves and say, so I think just knowing when you are worried, that's enough for you to go and seek medical.
That's a tricky one, Dr. Rukarwa. We know our community, we self-medicate and self-diagnose.
Yes.
So let's say maybe you have 6 patients coming into your clinic and they say, I have joint pains. How different will their stories be?
So each patient definitely comes in with a different story because no 2 patients are ever the same. So what we're basically looking at is the type of joint pains. And important is to establish, is this person having joint pains or is there evidence of arthritis? So there is a difference, right? So arthritis does present with joint pains, but we do have what's called arthralgias, where you just have pain without any evidence of inflammation. So those are people with arthralgias, and this typically happen when someone has injured themselves or has had a sprain. But when there's inflammation and evidence of arthritis, then those are things to worry about. In terms of what causes this, there are over 100 causes of arthritis. So that's why it's not enough to diagnose someone and tell someone, or when someone tells me they've got arthritis, you need to dig deeper and say what exactly is the cause, because treatment varies depending on cause and also the prognosis, meaning the outcome for the patient, what else to look out for, because sometimes when patients present with joint pains, it doesn't necessarily mean that it's just your joints that are involved. You can have other symptoms that can help to point towards more menacing diseases. So you're looking at things like causes of arthritis. They vary from anything from injuries, overuse, straining, so people who go to the gym can strain themselves, people who run or athletes, depending on overactivity and overuse, that can cause joint pains, all the way to wear and tear, which is degeneration, which is more common in the older the patients are, to more menacing things like inflammatory diseases, whereby you've got autoimmune conditions where your body is attacking the joints, and these are also varied. And we've got things that are more common in Botswana, like gout, where we've got crystals that deposit into the joints. So the cause of joint pains can be varied and numerous. And each patient, as they walk in, when you start taking a history, you're actually able to start seeing what the likely causes are. And from examination, as well as other investigations, you put everything together to come up with the possible cause.
But we actually associate joint pains with old age. I think that's what most people think in our community. Is it always true that it's always something to do with age?
So that's a very bad misconception or myth associated with arthritis as well as joint pains. So commonly, yes, the older you get, the more likely you are to suffer from aches and pains, especially involving your joints. However, when it comes to arthritis, it is a broad spectrum. So you've got patients who can present even from childhood, with joint issues all the way to middle age as well as adult. And like I said, depending on age, depending on presentation, then you need to actually be able to come up with a diagnosis and say what exactly is affecting your patient. So it's not just a once-off to say when you're young and you're actually having joint issues or pain or arthritis, you ignore it and say, I'm too young to be having this. You need to be checked, because especially if you're in the extremes of age, we need to actually establish what the cause is. Yeah.
Did you say kids also have joint pain?
Yes, I think my youngest patient in my clinic, though I'm not a pediatric rheumatologist, is actually a 10-year-old who has an autoimmune disease whereby his immune system is attacking his joints. So that's as young as it can present. And I also even have a 7-year-old as well. Yeah, recently I've been seeing who also has arthritis. So it varies. So it's not just a disease of the elderly. Like I said, depending on the cause, that's when you can actually make a decision on what the etiology and the likely cause of the disease is. Yeah.
Okay. So like right now, let's say there's someone at home who has joint pains. They don't really know what they should be doing, where they should go, when to seek help. What would you say to them?
So initially I would say depending on presentation. So if you're having acute pain we usually say within less than 6 weeks of pain. You can, I know most patients, they do home remedies, whether it's going to be over-the-counter painkillers, and they try and see if that will work. So I say if that hasn't worked and your symptoms haven't resolved, then definitely you need to go and seek medical advice to see a doctor or a rheumatologist, depending on severity. So I think severity will determine how quickly. If there's any history of trauma or injury, definitely you need to be seen sooner rather than later, because sometimes patients go for weeks or days while they're walking on injured limbs. So for example, you can have a torn ligament or a tendon issue. So those need to be treated earlier versus some things that are poorer prognosis. So those are people who can manage the disease at home. So if something is worrying you, the pain severity, as well as if it's chronic. So if you're having joint pain for more than 6 weeks, that's what we call chronic arthritis or chronic inflammation. Definitely that needs investigation to say, why has it not resolved on its own? Because our body tends to want to heal itself naturally. So if your body has failed, and usually within 6 weeks or whatever it is hasn't resolved, then definitely you need to get seen by a doctor, a GP, and if need, referral to a specialist.
Yeah, I think we are all familiar with what the culture within our community now. Most people are going to the gym, most people are working out, running, and I am sure they do encounter some pains here and there. Maybe if you can share with them, when should they seek help when maybe they have joint pains, knee pains?
So definitely with exercising and overuse, you can injure your joints. So number one, it's important when you decide to do exercises that you do them correctly. So not everyone should just hit the gym and start doing weights, and you can injure your joints, and then that can cause problems later on. So you need to be able to be given correct advice, correct guidance on how to actually do exercises when you do start. There are certain people who have difficulty with simple exercises such as running. So if you find you're running and after the run your knees, your ankles are painful, that may need to be investigated, especially if it's out of the normal. So you do expect normal joint pains that should resolve on their own. Initially when exercises do start, usually muscle joint aches can be present, but we expect that to resolve. With time your body gets used to it. So anything that's persistent after that definitely needs to be investigated so that we can see whether there's no injury associated with it or there's any structural abnormalities where a patient needs to be careful when they're doing certain exercises and modify according to their bodies. Yeah.
But now knowing the community that self-medicates, what are some of the things that people do that they assume are helping, but maybe worsening the situation?
Yeah, so I think prolonged use of analgesia, over-the-counter medication, that can delay seeking help. And you find that I've seen patients who've had arthritis that needs specific treatment, so maybe like your autoimmune diseases, and they've been taking painkillers for 2-3 years. So by the time you actually see the patient, there's now damage. Once there's damage, you can't reverse that. And it becomes harder to actually put that patient under control, their disease. So avoiding prolonged use of painkillers. If you're finding you're buying painkillers every week or every other day, needing to resolve your symptoms, that needs to be looked at. Use of prednisolone or steroids, I find it common. So a lot of patients are now aware that when they go to pharmacies and get the small white tablets, if they drink those, they feel better. They need to understand that prednisolone or steroids is not managing your disease. All you're doing is you're managing your symptoms, but you haven't actually sorted out the underlying cause. So that also results in delay of symptoms. Another thing I would want patients to avoid, especially those who know they've got gout or a history of gout, is the use of gout cocktails, because those are also not treatment for gout. It's basically a treating the pain, but you haven't sorted out the problem. So your symptoms will recur, you present late, and then you delay in management. Use of herbal supplements and I know collagen is a big thing these days. I always get patients asking me whether there's a benefit to that. So when it comes to these supplements and stuff you find in your health shops that purport to manage joint pain or assist with bone and joint health, medically we know most of these things, there's no evidence to support it. So I tell patients that as long as you feel there's a benefit, you go ahead. But if you take something for a month and you find there's no difference, you need to really look at it. Go and see a doctor and we put you on the right
treatment. So now if they can't take it anymore, like you're saying, the pain has been persistently going on and on and on and on. When they now decide to seek medical attention, what should they expect?
So when you've got joint pains and you go and see a doctor, first and foremost, what's important is to take a good history to find out when the joint pain started, to find out if there's any associated symptoms. So for example, if you've got joint pains together with a rash or together with other systemic symptoms, for example, you're tired, you're losing weight. So depending on the history, when the doctor asks you, is this just joint pains that are isolated versus joint pains associated with other things, it points towards a possible cause. Usually as well, there may be imaging that may be involved, so tests that we may do, ultrasound scan or x-rays. So I always say x-rays are more valuable if someone has a history of trauma, so you've injured yourself when we're looking for a fracture, or if your joint pains have been prolonged, usually within a year or two. So early joint pain, if you wake up tomorrow and you tell me that your wrist is painful, there won't be much I'm going to tell from an x-ray, except that maybe if the joint is swollen. That's all we pick. So sonography, MRIs are more specific. Then we've got blood tests that we do use to also help us to diagnose a possible etiology and then manage the patient. So it's going to be a combination of a clinical examination, a history, as well as investigations to try and come up with the diagnosis and then manage the patient.
But the investigations can be quite intimidating, Dr. Rukarwa. I can imagine some people will be thinking, maybe I have something really serious. How do you then help and support your patients to actually feel comfortable to actually go through all of those investigations?
So I think anxiety is a big thing because patients really don't want to be told bad news. Especially when you're told whatever your joint issue is chronic, meaning that there's no cure. So depending on the cause, some patients need lifelong treatment, where some patients, when you give them support with painkillers, physiotherapy or whatever, they get better and there's no need to continue. So I always tell patients that good education, it starts with your communication with the patient so that they establish a good rapport and relationship and they trust you as a healthcare provider to know that whatever you're doing for them is for their best. Once a patient has good understanding of their condition, it helps them to internalize it and they'll be able to then accept whatever the diagnosis is. And sometimes my patients take time. So I give them an option. Are you ready to start treatment? This is going to be chronic. It's a lifelong. Are you ready to? If someone is not, I don't start. When you yourself have accepted your diagnosis, then you can start. And then I've got the claustrophobic patients who are scared to go into MRIs and CTs. So I always ask, then we can give medication to help relax your anxieties. But once we need investigation, it's good that we come up with the proper
information. So if I'm not ready, Dr. Rukarwa, what happens now? Do I go home, think on it? Any medication?
Yes.
Okay.
So It depends. So some patients will tell you that I don't want to start this, but I'm willing to start that. So we go depending on what they're willing to do. So obviously if pain is the main issue, you are okay with pain medication, we go ahead. But if you're more concerned about the other chronic stuff that is needed to manage your disease, then it's a wait and see. So I always tell patients, when you're ready, come back. Or when your symptoms are more severe, come back. So that your patient doesn't feel like they're being forced, or it's not a dictatorship, because I always say you're the one going home with your diagnosis. So if you don't manage it yourself, it doesn't matter what I write, how long my prescription is, if you're not willing to take the tablets. So you find patients will take the prescription, go home, not take a single tablet.
So have you had that overwhelming point of long-term medication? Do you have clients that are not coping with long-term medication, and how do you then support them to actually adhere to the treatment?
So it's an ongoing thing.
Process, yeah.
So in every single consultation, I always ask, how are you taking your tablets? How are you coping? And for patients who start complaining, and it varies. There are patients who take 14 tablets, they are perfectly okay because they understand the gravity of their conditions. And then there are patients you prescribe 2 medications, and for them that's too much.
Yeah.
They don't want to be even on a single drug. So where we start off, the starting point, like I was saying, educating your patient is the most important thing. So I usually go through each and every drug individually to say, okay, this is why you're taking it. This is the reason. We cannot get rid of this one. This one we may consider with time, it may fall out. So when your patient has also goals and expectations to say, this is what we are targeting, we need to get to a point where you've got no painful joints, no swollen joints, and when we reach that point, we maintain you. So it's an ongoing process. And sometimes even after years, your patient will come and say, okay, I'm fine, I want to stop. And we say, okay, let's stop. You tell me how you do. When things start going bad, we come back. So it's not you shouldn't guilt your patient into taking medication, because then that affects their confidence, it affects their autonomy. They need to feel empowered and responsible for their care as well. Yeah.
So it's possible that over the years you can actually be weaned off some of the treatment.
So like I said, depending on cause.
Yeah.
So if we're looking at specific joint pains or causes of joint pains, there's some, like I said, are chronic, where you need to maintain the drug. We may consider lowering the doses with time if your patient has been doing well, but most of them we can't really take the patient off. Then other drugs, joint pains, depending on causes, the painkillers may be taken as and when needed. So you don't have to actually take
them
medication every day, but you get flare-up of the disease. There are days when you're in remission, you don't have to take the tablets. So it's important to have that discussion with your patient and the doctor, so your patient understands. Because remember, we said arthritis is not, it's a big umbrella term.
Yeah.
Under that, you've got 100 causes, and depending on you as an individual, what is causing your joint pain, your treatment varies, and it's based on that. Yeah.
Okay. So what symptoms, if you can take me back, what symptoms should not be ignored?
So we call them red flags, right?
Red flags.
Yeah. So if you're having joint pains, the red flags that you need to look out for, number 1 is chronicity. So if you're having joint pains for 6 weeks or more, that needs to be investigated. Number 2, if you've got any evidence of inflammation. So what we said, arthralgias are just joint pains. But if you've got inflammation, you've got a swollen joint, it's red, it's inflamed, you can't move the joint because of pain, that's all signs of inflammation that needs to be investigated as early as possible. Because one of the medical emergencies, especially in rheumatology, is what's called septic arthritis, where you have an inflammation in or around the joint that needs to be managed promptly with antibiotics and plus or minus surgery. So those are red flags. Other red flags to look out for, if you've got any systemic symptoms, so you're losing weight, you've got fevers or fatigue associated with it, that means that it needs to be investigated. If you've got any other symptoms like rashes or skin changes, muscle changes, anything else, not just joint pains, that also needs to be investigated. Because remember, we said other autoimmune diseases can present with joint pains as a primary cause. So that's another red flag as well. And another red flag would be basically if you are having any other condition.
Yeah.
So sometimes things like cancer can present initially with joint pains. So especially when I see elderly patients with joint pains, depending on the type of joints and severity, you need to look at other things, because blood cancers can present with joint pains, even solid cancers, colon cancer. Recently, I had a patient who presented to me initially with joint pains initially. Then when I went on to look at her blood, she was anemic. And I realized, okay, we need to investigate this anemia. Where are you losing the blood from? Further that, we went and did a colonoscopy. She actually had stage 4 colon cancer. So now when you go back, this joint pain actually helped us to go. So it's not enough to just say joint pains. It's important to investigate exactly what the cause is. Extremes of age, like I said, the elderly, the young, you also want to investigate, because in the elderly, cancer needs to be ruled out. In the young, it's usually autoimmune and other diseases that need to be investigated. And if your joint pains are symmetrical, so if both hands, both feet, both ankles are involved at the same time, you want to investigate that further. Yeah.
So, Dr. Rukarwa, I have some few myths here that I know my community, sometimes we believe we live by, just for you to demystify. I will just highlight one, and then you tell me if it's a yes or if it's a no. If it's a no, it means the myth is not true. If it's a yes, it means actually the myth is true. Arthritis is just an old age disease.
No. I think we've touched on
Yes,
that.
yes,
to
we
say any age can have it. Yeah.
Yes. Exercise worsens joint pain.
So not necessarily. So if patients do have joint pains, you'd still encourage them to continue exercising, but do it gradually. I always tell them pain will guide how you're going to exercise. So you also don't want to have a patient with arthritis who becomes a couch potato. He sits at home, because that's going to increase your stiffness, because your joints also involve your muscles. So if you're not going to use your joints, you're also going to lose muscle. So you also want to keep mobility as much as possible. So it should be graded exercises that's also guided even by a physiotherapist, especially if you're not sure or you're worried of injuring yourself. So definitely exercise should continue. Yeah.
But I know that some people believe when they're going to the gym, they should wear some knee support. Do they make any difference?
So the patients or people who need knee supports, remember we're saying people are different. So I've got patients with a disease called hypermobility syndrome, whereby their ligaments are not as tight and they don't give enough support to their joints. So when they do exercise, I encourage them to use a knee guard.
Okay.
So not everyone needs a knee guard. So if you find you strain your joints with certain exercises, definitely you do need support, but you need to also have it checked to see what is the cause.
Yeah.
Because what happens is when you do use your knee guards, you're actually not engaging your muscles as much as possible. So that can also affect your exercise. So knee guards should be used in conjunction with a proper diagnosis of why and when they're needed.
Okay. Yeah. Another myth, arthritis worsens in winter.
So I think that's not a myth, because most patients with arthritis do complain of worsening of their symptoms in winter. And the reason is because when there's a drop in temperature, it also affects the inflammation in your body. So you tend to know that with colder weather, you actually have reduced blood flow to your joints, and that can cause worsening of symptoms in terms of stiffening, as well as pains, as well as other chemicals that are involved in inflammation that tend to make it worse. So depending on what is causing your joint pain or what is happening, if there's active inflammation, so your joint is swollen and inflamed, you'd actually want to use cold. So I tell patients to use ice packs. But if the predominant feature is stiffness and pain, you actually want to use heat, because then that actually helps to relax the joints. So you find, because when it's cold, your joints become stiffer, they become more painful. So that's why warmth and temperature helps. And in summer, most patients do better than in winter.
Okay. And one last myth, one cure exists through diet and supplements.
Yeah, I think it's a challenge for most patients. So diet and supplements do have their part. So anyone with any chronic condition, whether it's arthritis or anything, we always encourage a healthy diet. You need to keep a good BMI, because if you're heavier you are, it's going to affect your weight-bearing joints, so your arthritis can progress faster. But there isn't a specific diet per se that has been proven, though there are some foods that have anti-inflammatory properties. So things like turmeric, garlic have been proven to help with inflammation, but you don't use them in isolation. So you want to use those things together with other medications depending on the cause of your arthritis. And then to just manage everything, like I said, whatever works for you, whatever you find a supplement is working. So things like your calcium, vitamin D, you need to be for good bone health, essential. So most of my patients are on supplements for that. And then other things depending on what it is, but it shouldn't be just the sole thing. But depending on the cause of your arthritis, then we use it together in conjunction with that.
Okay.
Yeah.
So in wrapping up our conversation, I think there's just one question I wanted to find out. When one gets a diagnosis, it's sometimes both a relief and also it also brings fear. Do you have any idea why those emotions exist all at once?
So I think with the diagnosis, for most of my patients, once they know what is happening, it eases a lot of the anxiety that was associated. Because I think a lot of patients, when they're at home, they catastrophize. They're like, oh, my knee is painful. Could this be arthritis? Okay, arthritis is the big term. Others will think about worst possible scenarios. Cancer, is this related to anything more sinister? So once you've seen a patient, have actually given them a diagnosis and a prognosis and a plan, that actually eases the anxiety. But for most patients, once it's chronic, that's what gives them a lot of fear as well, to say, now I have to take medications for the rest of my life. Now I have to take medications chronically. So it's a big balance whereby your patient does get relief because now they know why they're experiencing the condition, but also the need for treatment can also be challenged. And now follow up. Now you see your doctors regularly, where someone will tell you, I've been okay since birth. I've never seen a doctor. Now I'm 60. Now everything has fallen apart. The wheels are coming off. And yes, now you need to see a doctor regularly. So it's a combination of issues. But most patients, once you give them good education, reinforce it with every visit, ask them where they are, then it eases the anxiety with time. And then more importantly, other conditions are associated with anxiety. So you'll find that chronic arthritis, especially with autoimmune diseases like rheumatoid arthritis, anxiety and depression are actually part of what we call comorbidities associated. So it's something to look out for in your patients, because these are people dealing with chronic pain. Think of everyday activities you take for granted, just getting out of bed. For them, it's a job.
It's a job, yeah.
Just moving is a job. Handling anything, it's less pain. So that chronic pain and quality of life can affect their mood. So you always have to look out for that as well.
So while you look out for that, do you refer them to a counselor, or do they go through, what sort of help do you give them?
So depending on severity, for most of my patients, we usually do start off with a psychologist.
Okay.
Who helps them to do what's called cognitive behavioral therapy, where you now start approaching life in a different way and accepting your diagnosis and learning to manage it. And if that fails and I feel that the depression or anxiety is now affecting quality of life, then we do send them to a psychiatrist for medical intervention. So some patients may need pharmaceutical therapy as well.
It does go to an extent of being in a psychiatry.
Yes.
So
they are people go through a lot.
So in wrapping up, Dr. Rukarwa, there could be someone who is watching from home, who is hiding pain, who is trying to manage it, or who is just living through it. What's the one thing that you want them to remember from this conversation?
I think, first of all, listen to your body. Because when pain was designed to tell your body to stop and listen. So that's the main reason. Don't ignore pain. Don't give excuses. We've mentioned the red flags: chronic pain, debilitating pain. If there are any red flags associated with it, seek help. The good thing with most of these diseases, the earlier you present, the earlier it is for us to manage, and the better your outcome. But if you spend 3-4 years not having been on proper treatment, we're now dealing with other complications, and we can't reverse that. So know your body, listen to it, and respond accordingly.
I think you've had the good doctor. Pain is not something we should live with. We should seek help and not just self-medicate at home. If it persists, go seek help from a doctor and live a better life. Thank you so much for joining us at MedTalk. Your health is your wealth. We'll see you again next time.